My name is James Farrell. I am an Associate Professor of Medicine in the Division of Digestive Diseases at the UCLA School of Medicine in Los Angeles, California. I would like to take this opportunity to discuss our paper entitled Endoscopic Ultrasound or Percutaneously Guided Intratumoral TNFerade Biologic with 5-fluorouracil and radiotherapy for first-line treatment of locally advanced pancreatic cancer. This is a phase 1 and 2 study that has just been published in the journal Gastrointestinal Endoscopy. Now, TNFerade Biologic is a replication-deficient adenoviral vector that expresses TNF-alpha under the control of a radiation-inducible promoter. We performed a multi-center study, a phase 1 and phase 2 study to determine the maximally tolerated dose of TNFerade Biologic with standard chemoradiation therapy in the treatment of locally advanced pancreatic ductal adenocarcinoma. We enrolled 50 patients with locally advanced pancreatic ductal adenocarcinoma, and TNFerade Biologic was injected into these tumors using either endoscopic ultrasound or a percutaneous approach. The dose of the TNFerade Biologic ranged from 4 by 10 to the 9 particle units up to 1 by 10 to the 12 particle units. Injections were performed weekly for up to 5 weeks and in conjunction with radiation therapy and chemotherapy. Now, there are certain key points that I'd like to highlight about our study. The first is that it enhances our experience with endoscopic ultrasound fine needle injection in the management of pancreatic diseases. Patients in this particular study received 5 EUS-guided injections. The injections were performed with a linear array echoendoscope either transgastrically or transduodenally. 0.5 ml injections were performed 4 times into different areas of the tumor with a protocol previously described by Hecht et al. A total of 23 patients had the administration performed percutaneously, and the remaining 27 received their injections by endoscopic ultrasound guided delivery. There was no significant difference in survival based on the mode of delivery in this particular study. Now, response to chemoradiation therapy in pancreatic cancer as measured radiographically is difficult due to surrounding pancreatitis and pronounced desmoplastic reaction. In this particular study, 1 patient had a complete response and 3 patients had a partial response based on CT radiology criteria. And whereas the progression-free survival and overall survival were not primary endpoints of this study, it is interesting to note that the progression-free survival in this study was 3.6 months, which compares favorably with the reported 2.9 to 6 months in the larger randomized phase 3 trials for locally advanced pancreatic ductal adenocarcinoma. Similarly, the overall survival in our study was 9.8 months, which compares favorably with the reported overall survival of 8.2 to 11 months, again in these large phase 3 randomized treatment trials for locally advanced pancreatic ductal adenocarcinoma. Now, patients enrolled in our study had locally advanced disease at the time of enrollment and were felt to be surgically unresectable. So, in an unplanned exploratory analysis, 7 patients, or 14% of the study population, subsequently underwent surgical resection. 6 of these were found to have completely negative surgical margins, and 1, in fact, ended up having a complete pathologic response. 3 of these patients survived longer than 24 months. And it's also interesting to note that the delivery of the TNFerade Biologic did not interfere with subsequent surgical resection in any of these patients. So in conclusion, we believe that this dose escalation study does demonstrate the safety and feasibility of endoscopic ultrasound guided injection of TNFerade Biologic in conjunction with chemotherapy and radiation therapy for the management of locally advanced pancreatic ductal adenocarcinoma. It certainly enhances our experience with endoscopic ultrasound-guided fine needle injection in the management of pancreatic disease. The encouraging results that were demonstrated in this phase 1, phase 2 study subsequently led to the development of a prospective randomized treatment trial using 5-FU and radiation therapy with or without TNFerade for the management of locally advanced pancreatic cancer. Recent reports have indicated that this study has been discontinued due to lack of efficacy. So it is our belief that because of the activity demonstrated here, that perhaps the use of molecular markers such as DPC4 that could identify subpopulations that would have predominantly locally advanced disease may be one way of identifying patients who would benefit from this locally advanced endoscopic ultrasound guided approach to the treatment of pancreatic cancer.